Hi, welcome back, and if you're new here, thanks for stopping by. In this video, I'll go over points to remember for dimensional analysis, IV flow rates using a drop factor, mLs per hour for continuous IV fluids, flow rates for intermittent IV fluids, also called piggyback, and lastly, safe nursing practice for IV medication administration. So with dimensional analysis, remember to start with your known value. Identify the quantity and units you already have from the problem. Use your conversion factors to cancel unwanted units. You write the problem out in fraction form and cancel unwanted units. Keep your pathway clean. Match units diagonally to cancel the units properly. Double check your labels and look at your final unit to make sure it makes sense for the answer you're solving for. Know your common conversion factors. And lastly, and most importantly, practice regularly. Repetition builds confidence and speed, especially under test conditions like the NCLEX and clinical scenarios. Let's get started. For these two problems, we'll be dealing with the drop factor. Remember, the drop factor is referring to the tubing. It's on the tubing packaging, and it will either state 10, 15, or 20 drops per ml. For this problem, it's 15 drops per ml, and we need to get to drops per minute. So the order reads infuse 1,000 mLs of normal saline over 12 hours. I've set up the problem 1,000 over 12 hours. We have our conversion factor 1 hour is equal to 60 minutes times our drop factor, 15 drops over 1 ml. Our hours cancel and our mLs cancel, and we are left with drops per minute. Next, we will multiply across 1,000 times 15, and we'll divide that by 12, and then divide that by 60. Our answer is 20.83 repeating. We'll round to the nearest whole number, which is 21 drops per minute. There's also microtubing. It's a narrow tubing for smaller drops. The typical drop factor is 60 drops per ml, and that's useful in pediatric scenarios for administering fluids. Okay, problem number 2. The MD order reads, give 300 mLs of Unison to infuse over 30 minutes. The drop factor is 20 drops per minute. We're already in minutes, so we don't need to use a conversion factor. We'll set up the problem as 300 mLs over 30 minutes times our drop factor. The mLs cross-cancel, and we're left with drops per minute. We multiply across 300 times 20 gives us 6,000 divided by 30 gives us our answer of 200 drops per minute. The next set of problems are calculating mLs per hour. They're flow rates for continuous IV fluids. IV fluids are a fast and effective way to treat dehydration, especially when oral rehydration is difficult or impossible. These problems are pretty straightforward as far as the setup. For problem number 1, we're infusing LR 2,000 mLs over 12 hours. So 2,000 divided by 12 gives us 166.7 repeating, and we'll round to the nearest whole number, which is 160 mLs per hour, 167 mLs. Problem number 2. The MD order reads infuse D5W 1,000 mLs over 8 hours. Again, similar setup. We have 1,000 mLs divided by 8 hours, and that gives us our answer of 125 mLs per hour for our final answer. Problem number 3. The MD order reads infuse 500 mLs of normal saline over 2 hours. We're taking 500 mLs divided by 2. A lot of this can be mental math, but this is just good practice in writing it out. We take the 500 divided by the 2, gives us 250 mLs per hour for our final answer. Problem number 4. The MD order reads infuse normal saline solution 2.5 liters over 18 hours. So we need to figure out what we're going to set our pump to infuse the 2.5 liters over 18 hours. Ultimately, we want to get to mLs per hour. So our conversion factor is 1,000 mLs is equal to 1 liter. We set up our equation, what the doctor ordered, 2.5 liters over 18 hours times our conversion factor, 1,000 mLs over 1. We cancel our unwanted units and multiply across. 2.5 times 1,000 gives us 2,500. We then divide that by 18, and that gives us 138.888 repeating. We'll round up to the nearest whole number, which is 139 mLs per hour for our answer. The next couple of problems are calculating flow rates for intermittent IVs, also called IV piggyback or IVPB. So the key factor with these problems is that the medications are infused over a short period of time. Problem number 5. The MD orders infuse 350 milligrams of azithromycin diluted in 100 mLs of normal saline over 60 minutes. So the desired units that we want are the mLs per minute, 100 mLs per 60 minutes. Don't get confused with entering the 350 milligrams into the equation. So we've set up the problem, 100 mLs over 60 minutes times our conversion factor, which is 60 minutes over 1 hour, and then we'll work our problems diagonally, cross-canceling the minutes, so we're left in hours. 100 times 60 is 6,000, divided by 60 gives us 100 mLs per hour. Now, since the infusion time is already 60 minutes, which is equal to 1 hour, the amount infused in 60 minutes is exactly the same amount infused in 1 hour. I've just written it out with the conversion factor to illustrate the dimensional analysis setup. Problem number 6. The MD orders to infuse 250 milligrams ampicillin diluted in 50 mLs over 20 minutes. The RN should set the pump at what flow rate for mLs per hour? So we set up our equation, 50 mLs over 20 minutes times our conversion factor, 60 minutes is equal to 1 hour. Cross-cancel our unwanted units of minutes, and we're left with mLs per hour. We multiply across. 50 times 60 gives us 3,000. We divide that by 20, which gives us our answer of 150 mLs per hour for our answer. So if you enjoyed this video and it helped in any way, please consider to subscribe and hit that like button. It really helps my channel grow and reach a further audience. So next, I'm going to talk about safe nursing practices for IV drug administration. Some key points to remember include monitor all IV flow rates hourly as needed. If the flow rates become altered due to the patient's positioning or a kink in the tubing, it's important to catch that quickly. Next, observe the infusion site for signs of infiltration, such as swelling, coolness, and/or pain. If the signs are present, discontinue the IV and restart at another site. Always assess for allergic reactions to the IV drug. If reactions are seen, stop the flow rate and the IV drug immediately. Always assess for signs and symptoms of phlebitis. This includes redness, warmth, swelling, and pain to the site. Redness may be seen above the infusion site or along the vein. Check for air bubbles in the IV tubing. Remove air from the tubing by clamping below the bubbles and aspirating with a syringe, or use the method that is indicated by your institution. And lastly, change your IV site every 3 days or as indicated. Change IV tubing every 24 to 48 hours and change IV bag every 24 hours or by your institutional guidelines. Thanks again for watching. We'll see you on the next one.